Knock, knock, knock. Hi, my name's Todd. I'm going to be your nurse today. Um, I already hand hygiene with soap and water before I came in, but I'm going to hand hygiene really quick. Okay, put some gloves on. Mr. Anderson, let me provide you some privacy. Um, can I have your name and date of birth? You said John Anderson 3376. Let me check here. John Anderson 3376. That's what I have here in my paperwork. Mr. Anderson, do you have any allergies? You have no allergies at all. Okay. No medication allergies, no food allergies, no latex allergies. All right. I'm here to check your GI suctioning. Okay. I'm just gonna be assessing it, and I'm gonna be assessing your GI system and your abdomen. Okay. Do you have any pain right now? No, like a little bit. Okay. So on a scale of 0 to 10, 10 being the worst pain you ever had, and 0 being none, what would you say your pain is at? Oh, one? Okay, that's fine. And where's your pain located? In your belly? Okay, I do see your belly's a little distended because you have a obstruction, and that's why you have the suction tube in there. Okay, so what I'm going to do, before we started, I already did your basic assessments, your blood pressure, your respiratory rate, all of those things I've already done. So what I'm gonna do, I'm just gonna assess the tubing from your ear to your nose. I'm gonna look for any breakdown or any skin irritations, and it's fine. Okay. Um, so your tubing is set on low intermittent suctioning. It's from 20 to 40. Okay, it's 20 to 40, and that's like what it is right now. But some facilities go from 40 to 80. It just depends on your facility policy. But right now, you have low intermittent suctioning, 20 to 40. And your medications you're taking right now, you're taking ondansetron and your stool softener, your Biscotti. So your stool softener is just to help to soften things up, and your ondansetron is for your nausea. Okay, so as far as your to keep you your things to prevent complications, we'll keep you at 30 degrees height to keep you from aspirating on any gastric content. And secondly, we'd have to keep checking the placement, or we have to keep your tube on intermittent suctioning, and we have to make sure it's not continuous because it could touch somewhere in your stomach lining. If it's on there, it could actually cause you to have an ulcer and bleed, and then we have a whole bigger problem, so we don't want that. Um, so we have your going through minute suction. So now what I'm gonna do for you, I'm going to assess your abdomen, okay? Let me just lift your shirt up here. Okay. All right, let's lift your shirt. Do you just have a little bit of pain, right? But is it okay if I assess your abdomen? Okay, before I do that, I'm going to turn off the suction so I can hear. Okay, so that's off. So I'm just gonna listen in all 4 quadrants. Okay, do you have like hyperactive bowel sounds right now? It's just things aren't moving a little too much in there. I don't really hear flatulence. No, if I didn't hear any bowel sounds at all, I would listen to each quadrant for 5 full minutes. Okay? And since I hear just a little bit of bowel sound in each, it's very low, it's hypo. I don't have to listen for the full 5 minutes. So I would provide you, let me cover you back up. I would provide you your IV, assess your IV site here. It's patent, there's no redness, swelling, infiltration. It looks good. And that's for your IV fluids that are flowing in your system to keep you hydrated. I would also monitor your electrolytes to make sure you're hydrated, you have proper electrolytes, because we are suctioning your gastric contents. And so I think that is. Wait. Okay, so I'm going to go ahead. I know you said your stomach was a little hurting, but is it okay if I palpate? Okay, so I'm just going to touch gently. Is there any pain? Is it a little tender? Okay, and you did tell me that you haven't had a bowel movement for how long? It's 2 days, so that's why you came in, because you haven't had a bowel movement for 2 days, and your abdomen was really hurting you and you were nauseous. I understand. So for your interventions, we are going to continue to give you the antiemetics. We're going to keep giving you your fluids to hydrate you. We'll keep giving you stool softeners and see if we can get that mass to pass. We'll just keep evaluating you, listen for bowel sounds, and see if things start moving. Okay. Again, thank you. We'll just keep checking with you and giving you pain medications to get through this. All right. All right, Mr. Anderson. Thank you again. All right, I'm going to go ahead and document this and put it in the computer, and I'll let your provider know that, what I found, and see if they want to do additional orders. So I'm going to hand hygiene, and all right, thanks, Mr. Anderson.